Hi everyone! Welcome back to my YouTube channel. This is 𝗤𝗎𝗓, your student nurse. Today I will be demonstrating the proper way of postmortem care, a respectful and essential part of nursing practices. So, let's begin. Before anything else, assess the family's cultural, religious, and personal belief. Be respectful and sensitive to their practices, ensuring that do not interrupt any rituals or customs. Confirm that they've completed their cultural or religious rites. Check the chart to verify if organ or tissue donation was requested or if any autopsy is required. Always ensure that any organ or autopsy consent is properly documented and validated. Provide dignified and compassionate nursing care. Offer the family a chance to participate in the preparation if they wish. Ensure you all have the necessary equipment, including gloves, gown, washcloth, towels, a basin, body scrub with tags, scissors, bed linens, documentation form, and lastly, a clean hospital gown. Start by reviewing the patient chart to confirm the time and declaration of death by a physician. If autopsy or organ donation is requested, validate it accordingly. Consider religious or cultural practices throughout the process. Prepare all supplies and bring them to the room, ensuring they are labeled clearly. Explain the procedure to the family and verify that they understand and agree. Identify the patient using 2 identifiers and follow the facility infection control procedures, especially when dealing with infectious cases. Place a sign outside the room, close the door, and pull the curtain for privacy. Prepare the water for the bed bath. Perform hand hygiene and don full PPE. Raise the bed, flatten it, and remove all linens, blanket, and the gown. Also remove any medical devices or drains per policy. remove the watch and the ring and restore them as appropriate. If culturally appropriate, use a rolled up towel under the chin to close the patient's mouth and close the patient's eyes by gently pulling the eyelids over the eyes. Insert cotton balls in the nose and ears to prevent leakage of body fluids and maintain a more presentable in appearance for viewing. Give the bed bath like you would if the patient was still alive. Place an absorbent pad under the patient's buttocks, wash the body parts, and if the family members or a caregiver are assisting with washing the body and providing postmortem care, instruct them to don gloves and gown as protection from body fluids. Give the patient a complete bed bath including perineal care. Dress the patient in a clean hospital gown and groom their hair. Identify which of the patient's belongings are to stay with his or her body and which are the belongings given to the family by making a list to be signed. Tie a name tag on a patient's big toe. This video is for written purposes only, so I don't have a body bag available to properly secure the deceased. For now, I will temporarily cover the body with a clean bedsheet to preserve dignity and respect. Place dentures and glasses to go in the body bag with the patient, and the last name tag should go with the patient's remaining belongings. Make sure the belongings get to the patient's family. Ensure that prompt transportation of the patient's body to the mortuary has been arranged. Observe family members, friends, and significant others' response to the loss and provide support as needed. Discard used supplies appropriately, remove PPE, and perform hand hygiene. Document the procedure in the patient's record, such as special preparation of the body, medical tubes, devices or linens left in or on the body, personal articles left on and secured to the body, personal items given to family with description, date, time, and to whom be given, and location of body identification card.